Let's talk about complications of the spinal cord injury. It may be neurological, and neurological complication there is loss of motor and sensory function below the level of the injury, loss of motor and sensory function below the level of the injury, and spasticity and hyperreflexia in the upper motor neurons, and neuropathic and or phantom sensation. So neurological problem, loss of motor and sensory function below the level of the injury, spasticity and hyperreflexia, and neuropathic pain or phantom sensation. Respiratory is respiratory muscle weakness, risk of pneumonia, atelectasis, and respiratory failure. Respiratory muscle weakness, especially in the cervical injury, there may be risk of pneumonia, atelectasis, and respiratory failure. On cardiovascular, there may be orthostatic hypertension, autonomic dysreflexia, life-threatening hypertension if lesion above T6. Autonomic dysreflexia is a life-threatening hypertension in autonomic dysreflexia is life-threatening hypertension in lesion above T6. There may be urinary problem. Urinary is neurogenic bladder and risk of recurrent urinary tract infection or renal damage. Risk of urinary tract infection and renal damage. On gastrointestinal, there may be neurogenic bowel constipation or incontinence, ileus in the acute phase. On musculoskeletal, there may be muscle atrophy or and joint contracture, osteoporosis, pathological fracture, heterotrophic ossification. On skin, there may be pressure ulcers due to immobility and loss of sensation, sexual and reproductive, erectile and ejaculatory dysfunction in males, fertility issues and menstrual irregularities in female. On psychology, there may be depression, anxiety, adjustment disorder, depression, anxiety, and adjustment disorder. There may be social isolation and loss of independence. Other is deep vein thrombosis, pulmonary embolism. There may be chronic pain syndrome. So, neurologic, respiratory, cardiovascular, urinary, GI problem, MSK